Morning esteemed guests, policymakers, healthcare professionals, and fellow citizens. Healthcare is built on trust. The trust that when a patient steps into a hospital, they will receive competent, ethical, and timely medical care. But when that trust is broken, the consequences are irreversible. Medical negligence is something, it is not just an unfortunate event. It is a breach of duty, a violation of fundamental right to life guaranteed under Article 21 of the Constitution of India. On October 20, my elder brother was admitted to a hospital in Rewa, Madhya Pradesh, one of the top tier 2-3 cities in the country. He was having severe stomach pain. For the next 3 days, instead of diagnosing the root cause, the doctors kept him treating they were in their endeavor to suppress the pain. And consequently, his situation got worsened, and we had to rush him from Rewa to Nagpur, one city in Maharashtra, almost 500 kilometers. It took us 10 hours to travel him and rush him to that hospital. Throughout the journey, he did speak only 2 or 3 words, and all the words were broken. By the time he arrived in Nagpur and he was operated, we learned during the course of treatment that for all the time his intestine was punctured and infection has spread, and he succumbed to those infection by 25th October. Death is inevitable, nothing and no one can stop him. But when a patient is fighting for his life, her life, their hardest battle is not fought alone. Even families is struggling. They are fighting a different war, an emotional, psychological, along with the financial struggle. But the greatest pain is losing a loved one without being able to see them one last time. There is a dark side of medical care, lack of transparency, and it is rarely gets discussed. In tier 3, 4, 5 cities, patients rarely know what treatment they are being given. And this is not limited to medical jargons. It is also about a deeper systematic lack of transparency. Many patients are treated without being properly informed about their condition. Their families are left making decisions without full knowledge of risk and prognosis. But let me be clear, this issue is not limited to smaller cities. Even in tier 1 and 2 cities in these hospitals, patients often have no real clarity about their treatment, their rights, or their options. Informed consent, a fundamental patient right, is often reduced to a mere paperwork. And this lack of transparency, this culture of silence is what allows negligence to continue unchecked. While legal and systematic reforms are crucial, we must also address the emotional and psychological trauma that families face. Often when a critically ill patient is admitted to the ICU, their loved ones are not allowed to be with them. They all are waiting outside the ICU to visit them in limited visiting hours. And while it is necessary for medical reasons, it should not mean complete isolation. I propose a system of video conferencing in ICUs, a simple yet powerful solution. A screen with a camera that can be placed outside the ICU for family members, while another screen is placed at safe distance from the patient's bed. This way, patients can see their loved ones and their families can see them, without disrupting medical care. With advancement in artificial intelligence and virtual reality technologies, this system can be made even more interactive. It would provide comfort, emotional support, and dignity to patients in their final moment. No one should die alone without seeing their loved ones in their final moments for the last time. My brother passed away without any of us being on his side. We never get to see him alive one last time, and he never saw us. No family should have to go through the same pain ever and ever again. The legal framework has to be evolved to ensure that medical errors are prevented, patients are empowered, and those responsible for negligence are held answerable. Because ordinarily justice delayed is justice denied. But when justice is delayed in healthcare, it is not just justice denied, it is a life denied. Thank you.